Namaste everyone. Hope you're all doing good. Over the next few minutes, let me take you through the journey of COVID in the current scenario. In the present pandemic, any symptoms like fever, cold, cough, loss of smell or taste, and body pains, headache, as well as a generalized sense of weakness and fatigue, plus or minus with a history of contact, would be considered as probable COVID, and you might have to reach out to a doctor immediately. The doctor most likely would ask you to undertake a RT-PCR test, and this is a diagnostic test. And this measures and identifies the genes of the virus. There is a value called the CT value, and this might be a very crude indicator for us to understand the virus load. Imagine you had to fill up a bowl with all the viruses in your body. If you had just 2 viruses and this capacity is 1000, it takes a large number of cycles. 2 has to become 4, 4 to 8, 8 to 16. So large number of cycles to reach 1000. But if you already have 500 viruses, it's just 1 or 2 cycles. So a large CT value indicates a low virus load, and it's vice versa. As I said, it's a very crude indicator, sometimes helps us to understand the course over the next 2 weeks. So this entire course, you can look at it as 4 phases, or let's say 4 slices of a pizza. Each phase has got about 3 to 4 days of duration. And the first 1 week has got the first week, first part, that is the first 3 to 4 days. This is when all the symptoms happen. So after an incubation of an average of 5 days, you begin to get some symptoms, and the virus continues to multiplicate. It multiplies in your nasopharynx or the back of the nose and the upper throat, and the symptoms are related to where it is now. So you get loss of smell, sometimes cold, throat pain, fever and all. As the virus keeps multiplying and causes problems, your body mounts a first response. This immune response puts up a wall and tries to limit the virus just to the nose. And over a period of 3 to 4 days, you tend to get better with your own immunity. Next 3 days, that is the second part of the first week, is when you start to feel better. The symptoms come down, but the virus continues to replicate and it starts to multiply much more now. By the end of the first week, you have a large amount of virus, but it's all walled off, walled only in the nasopharynx. And the first few days of the second week or the third part of the disease is when all the damage occurs. Now imagine a balloon getting filled up with water. You keep filling it up, you keep filling it up. After a stage, it just breaks and then a storm comes out. A similar thing happens with the body as well. There are 2 things that happen now. One, your body starts to put up a dysregulated immune response, which includes coagulopathy as well. And second, the virus has now multiplied and is about to reach its peak numbers. So both of them together tend to happen between day 5 to day 9 on an average. So the beginning of the second week is when all the danger happens. So there's a sudden cytokine storm, and just like a storm leaves havoc, these cytokines cause damage, and these cytokines help in putting up a little defense against the virus, but that storm is what causes the problems. The virus now starts to invade the lungs, and the spaces in the lungs where air had to go in and out is now full of fluid and the viral debris. And instead of an available space for oxygenation, it now becomes hard, fibrotic slowly, and the space which is available for oxygenation comes down. So eventually you tend to breathe faster to take in that oxygen, and when you cannot compensate it anymore, that's when the oxygen levels drop. So oxygen levels dropping is probably towards the end of the third part of the illness. You can easily detect it in the first part, second part, and also in the third part. Now the third part, as the inflammatory cascade builds up, there are a couple of blood tests that indicate to you this is going to happen. There's an impending cytokine storm coming up. So we need to be careful at around that time. Now the last part of the illness, that is the second phase of the second week, which is usually between day 11 to day 14, is when things get better. the immune response slowly gets lesser. The virus had already finished its multiplication by day 8 or 9. It cannot multiply anymore. So these concepts hold good for us when we try to manage the patient as well. Let me quickly take you through a interesting slide which explains the rationale of the medicines which are used. Now, if you look at the initial phase, after the incubation period of 5 days, you begin to have symptoms, and the day of symptoms is very, very important. It tells you what is likely to happen next. The virus continues to multiply and you begin to put up an innate immune response. So by about day 5 or 6, which is towards the end of the first week, is when the virus has slowly begun to come down, but then your immunity is also improving, so you tend to feel better. But the problem comes with this part, the dysregulated inflammation and the inflammatory coagulopathy. This starts on day 7, and this balloon which had all the water suddenly bursts, and this causes the problem. So what works at which stage? In the first few days, it is all about symptomatic care, and 2 medicines which are recommended in the current Government of India ICMR AIMS guidelines are ivermectin and inhaled budesonide. These 2 medicines help in the mild cases and in the early phase of the disease. This is when you need it. Now, as you reach day 7, what you exactly need at this point is something that can counter the inflammation. So you need an anti-inflammatory agent. Anti-inflammatory agent is a steroid, the most potent one which we have. So steroids continue to be the mainstay of treatment of COVID, especially at around this phase when the inflammation happens. Giving this steroid too early is actually going to blunt your immune response. So you don't want to give a steroid too early in the course of the disease. You want to give it so that this dysregulated immune response comes under check. And the second drug, remdesivir, has a role because it is an antiviral. So it's very specific. You cannot give it towards day 10, day 12, day 15. The virus replication is over. It has no role at all there. So it helps on stopping the viral replication just around the time when the inflammatory response has started. So this is where it helps. But the mainstay of treatment continues to be ivermectin and inhaled budesonide in the first few days and in a mild case. Then you can use steroids, oxygen, and a couple of experimental drugs, as they are called as of now. And these will help you tide over the crisis. As you see, by day 15, most of the time things settle down. Either you are able to counter this immune response, come out of it, or it might worsen. Your lungs get filled with the debris and also the inflammatory cytokines, and you may need additional support. Ventilator most of the time would be necessary when you need external oxygen. Ideally, you should be able to breathe passively and be able to exchange oxygen without even your notice. But when you're trying too hard and you're not able to sustain that levels of oxygen which are necessary for organs to function, that is when a ventilator is needed. Ventilator is only going to just give oxygen in and out. It's not going to clear the problem. It will not take away the underlying cause. It is just a replacement for your passive breathing actively through a equipment that just pumps in oxygen based upon the lung tissue characteristics for a limited period of time. So this is how the disease has 4 parts. The first part of the first week is when the symptoms happen. The second part of the first week is when you start to feel better. The third part, which is the first part of the second week, is when the worsening might happen, and this is because of a dysregulated immune response and the sudden burst of cytokines, sudden burst of the virus, which starts to involve the lungs now. The last part, which is the second part of the second week, is when the recovery happens, or you tend to succumb to the inflammatory cytokines and also the huge virus load and the viral debris, and you might need further care. This is how the virus takes its course in our body over 2 weeks, and it's important to recognize the second part of the first week, which is where you tend to feel better, and suddenly you drop your guard, you stop monitoring, you stop looking at the symptoms seriously. And many a time, if we can pick it up around this time, day 4, day 5, day 6, If they continue to have symptoms, it means your body has mounted a dysregulated immune response and the virus is probably multiplying at its peak. And this wall of defense that you have put up is going to break down in a couple of days. And your actions start much before your oxygen drops. Your oxygen drops only as the last measure. You need to act before that and ensure that you are not compromising on the oxygenation. Otherwise, it's an uphill course after that begins. I hope this clarifies many of common myths and misconceptions related to the disease. A lot more is left to our understanding, and more evidence continues to guide us in our day-to-day management. And the disease has evolved itself from last year to this year, and it tends to surprise us, and also we are trying to match it by coming up with strong evidence which can guide us in the management. Thank you.